Bill Kovinsky, the forgotten Canadian and the first known AIDS death in Canada before it was even named. Welcome back to Here Queer and Maple Syrup, a look at queer Canadian history, an extension of my TikTok series. I'm Jacob, your host. Let's explore the AIDS crisis in Canada together. For decades, all roads pointed to the first AIDS deaths in Canada happening after 1982, when it was officially recognized. It was only later that doctors began retrospective diagnosis. On top of that, anonymized case studies made it difficult to really help anyone beyond generalizations. And significant social stigma meant queer folks who had AIDS were hesitant to seek medical help when they had symptoms. The dates changed, however, in 2022 when Walter Cassidy, a teacher from Windsor, Ontario, did an interview with the Windsor Star and revealed that the first Canadian to die of AIDS was named William Bill Kovinsky, a 43-year-old stockbroker from Windsor who died on the 18th of February 1982 of what was then known as GRID, gay-related immune deficiency. It was in March, literally the next month, that doctors confirmed the presence of AIDS in Canada. A medical case report titled Pneumocystis carinii pneumonia in a homosexual male, Ontario, was released that month in the Canada Diseases Weekly report. Bill was merely a number. He was not named. He was not recognized. His family was only told that he died of pneumonia. His doctor referred him to the Laboratory Center for Disease Control because of his symptoms. When Bill died, he was still in the closet, which was unfortunately very common for many queer folks at the time. We don't actually know much more about Bill, other than his employment as a stockbroker, that he was gay. He had a sister who is still alive today and did an interview with the Windsor Star, and he was deep in the closet. Even though in Bill's case, no one knew his name, it was the first time someone said explicitly that someone had died of AIDS-related causes in Canada. Retrospective diagnosis in Canada began in the mid-1980s. The officially released numbers have 2 in 1979, which we've talked about before, 3 in 1980, and 10 in 1981. It is important to note that these numbers are likely only scratching the surface of the actual numbers of AIDS cases in Canada, especially with the virus that would later be known as HIV, being dated back to at least the 1930s. And that researchers in the US have identified a Black man as having HIV back in the 1950s. The numbers of retrospective diagnoses of AIDS in Canada are likely either mainly white folks or only white folks, particularly those from more urban and progressive areas. When we look at when the supports for those in racialized communities came into effect, it is likely that any other people from these communities were excluded from these numbers. And this fact matters because retrospective diagnoses indicate who had access to care in the first place. When Black and Indigenous communities faced systemic barriers anyway, without even taking sexual orientation or gender identity into account, if you add queer identity into the mix, the barriers they faced were even higher. There were also barriers faced by those in more rural settings. It is likely as well that those in more conservative areas didn't seek medical care out of fear of being outed or being ostracized from their communities. Health Canada predicts that up to 26% of AIDS cases went undiagnosed. I would argue that the numbers are probably higher. In Bill's case, he was a white man in his 40s with a good job. He didn't face many of the barriers to healthcare that other members of the queer community would have faced at the time, which means that the next logical question is, was Bill Kovinsky actually the first Canadian to die of AIDS? The answer is likely no. He is just the first person based on the records we have. When we look at the number of cases that have been diagnosed retrospectively and the average life expectancy of those living with AIDS before there was any sort of treatment, which was around 12 to 15 months in Canada at the time, it is highly likely that there were significantly higher deaths prior to 1982. Those numbers would likely rise significantly if we look at non-white groups as well. It is actually thanks to Bill Kovinsky that we have a much better understanding of the AIDS crisis in Canada, because dates have been adjusted and more people have been retrospectively diagnosed. A major issue in the early days of the AIDS crisis was the anonymity of the patients. It prevented allowing the person's loved ones to properly mourn. While the goal was likely to protect the privacy of the patients, it ended up causing significant erasure that skews our perspective of the AIDS crisis and its impact here in Canada. The erasure also likely led to a lack of early treatment access. Delayed naming alters the public memory. When all we see is a number or a description of someone's condition, it blurs our collective memory. It leads to the humanness of the person being made cold and detached as this person is made into a statistic rather than keeping their humanness. Particularly in a time when, to the rest of the world, people who died of AIDS-related causes were merely statistics, or worse. One of the most important things to remember about the AIDS crisis is that the people diagnosed with HIV and AIDS and those who died were people first. They were human beings who deserve to be mourned and remembered. They deserve to be more than just statistics in a medical journal. Bill Kovinsky matters not because he was first, but because he challenged the predetermined timelines of the AIDS crisis in Canada. He was one of many who opened the door to retrospective diagnosis. He showed us that there are many unnamed Canadians who died before the official timeline begins, and that there are many more who we will unfortunately likely never know the names of. Bill's name comes to us 40 years after his death, but many who were anonymized never will. It was this coldness that led to many of the protests that the AIDS crisis became known for. We will talk about those in the next episode. Until next time.